I'm Dr. Pubali Deka. I'm a developmental pediatrician. So today we are much aware of this neurodevelopmental condition, which is defined as deficit in social communication delay with some specific patterns like restricted interest and repetitive behavior. These children also have sensory processing disorder. So if you see a 6-month-old infant who is not responding to name call or is not giving a interactive smile, not giving a meaningful eye contact, or if at 1 year the child hasn't started babbling, if at 16 months a child hasn't started using 1 or 2 meaningful words, or by 2 years a 2-word phrase is not being used, or maybe if some vocabulary which was achieved has been regressed, or other developmental milestone has been lost in the social communication domain, then we must suspect autism spectrum disorder. So these could be red flags. So pediatricians, when they see these children during a regular well child visit or during any immunization, besides assessing the other developmental milestone, they must also look for red flags of autism spectrum disorder. As we do not have a test or biomarker for autism, so it is basically diagnosis is based on clinical observation and assessment, which is done using some specific tools, so that we know the functional status of the child, so that an individualized plan can be made, as no two child of autism will be same. Every child will have different deficits in language. They may have different intellectual disabilities. So the word autism should not scare us. It is basically a terminology which would refer to a group of symptoms. We need to focus on targeting the core deficits of social communication skills. So early intervention will definitely bring a lot of changes and development in these children, but I would prioritize that parental involvement, home stimulation should come at first. Only then other therapies like occupational therapy, behavioral therapy, speech language will come. Sometimes we need to give medication to such children as well. So we must understand that these children are a little different, they are diverse, but they have certain uniqueness, and we need to take them move forward in the society. So when we talk about an inclusive society, we must start inclusion at home front first, only then at school, and then at society at large. So they have a right to a dignified life as much as we do. So we all need to work together with an humanistic approach.